talk about what's happening with the COVID-19 virus. Things are changing very quickly. We just were talking about a few of those things. So after we get done with our briefing, there'll probably be things that are no longer accurate, but we'll try to be as up to date as we can. I have a variety of staff here to help with the briefing this evening. Steve is going to provide an overview of kind of where things stand globally, but also how things are looking locally as well. Things related to our pandemic plan, our emergency response plans. Sorry, thank you. And other related matters. Nancy's going to provide a general overview of some HR-related issues or policies we've been put in place. Soren, I think, might help out a little bit with having council meetings remotely, how we can do that legally. Then Clint is going to provide an overview of where we're at from a technological perspective, including our staff working remotely, as well as the council conducting a council meeting remotely as well and electronically. And then we'll wrap it up. I really want to get to your questions for sure as soon as we can, so we might move through this kind of quickly. Before we end also, as I mentioned in an email to you today, we are suggesting the council adopt an emergency declaration. You have a copy of a proclamation and a resolution in front of you. You don't have to do that, but if you would like to do that, we'll need to amend the agenda when we get to that as a part of the regular council meeting. And Soren can answer any questions that you might have on that as well. Before I turn it over to Steve, the only other thing I wanted to mention from a kind of current status perspective is a message I sent to you earlier today. Based on where we're at with our pandemic plan, we're at a level 4 category out of 5, and given what the actions that the governor is taking in other communities as well, I have decided that we need to close the rest of our public facilities to public access to protect not only the public, but our ability to continue services to the community. That doesn't mean that we are going to stop providing services. It may involve triaging a little bit in terms of those services that we do provide. Employees will still be working here at City Hall. Some likely will be working remotely, and others may just be on leave until the work is present for them to accomplish. So I just wanted to mention that to the council and to the community. We will be putting out a statement after the council meeting tonight commenting on that and some of the other things that we're doing about this pandemic. So with that, I think I'll just turn it over to Steve, and I am the official yes, that. Go ahead, Steve. Oh.
Mayor, Council, guest, I'm Steve Coring, your Fire Chief and Emergency Management Coordinator. Appreciate the opportunity.
Steve,
Should be on, right?
Okay, green light?
My
Just
voice
wanted to make
usually
sure.
carries much better than that. So I am here tonight to give you an update, state of the state, so to speak, to figure out where we're at, and just kind of a 50,000-foot view of where things are currently at. We're going to try to talk a little bit about that state, what our pandemic plan looks like in a very broad sense, kind of what public safety response might look like going forward, community collaboration that's going on and has been going on for probably literally since the 1st of March, and then some of the challenges and opportunities that exist within our community to help kind of control this to the best we can. Next slide. So this is all standard stuff. I'm sure everybody's been daily looking for updates on the MDH website. So this is the number of cases as of today that were confirmed, 54 in the state of Minnesota with 1,893 people tested. Cases in St. Louis Park, unknown, tested unknown, which is a challenge that we're dealing with in the kind of this healthcare confidentiality world. I've been on the phone most of this afternoon with players trying to understand how we change that. Next slide. So as part of the planning process, we obviously invested a ton of time with stakeholders, and these aren't stakeholders that are really new to our community. They're people who we connect with all the time and really have ongoing relationships with, and really aren't trading business cards for the first time. We're already engaged on a lot of different levels with them. So the schools, we have met. I had a couple of different planning sessions with the schools, talking through their plan, helping them kind of understand the ICS concepts and how to structure response and scale up their operations and resources. Park Nicollet, we've been engaged with their emergency management operations for 3 weeks as they went through kind of partial and full activations of their EOC, helping them find facilities, outsourced facilities for overflow and surge capacity, and then this latest was the drive-through testing sites. STEP, so there's been a concern about STEP and the controlling the kind of how that facility stays clean. And so I was working with them last week, and we talked through some stuff, and I think he's got a great plan now as to how we're gonna kind of manage the safety and security of that building. Senior facilities, this is an important part of our community. They're probably the most vulnerable population of this particular virus, and we happen to be one of the most dense populations of seniors in the state within this 11 square miles. So it's been a huge priority of ours to work with each of these facilities to understand their planning, their emergency management planning, as well as how are they controlling and isolating their senior populations, at-risk populations, between facilities where it's independent, assisted, and memory care, in our skilled nursing facilities, how they're controlling influenza and norovirus, and then adapting to these other quarantine and isolation issues with corona, and then working with them to help facilitate a response plan where EMS is serving them in a different way potentially going forward based on the amount of demand that we're getting for calls. Hennepin EMS, our EMS partner, they're the ones who have the ambulance service for our community. We've been working with them regularly, and we have a conference call actually every day with them. And then our mutual aid partners for fire response. Even though EMS is a big part of our business, we still have to continue to make sure that the city doesn't burn down. And so we need to make sure firefighting and fire protection and fire prevention still remain a key focal point for our community. So the pandemic plan, which was, interestingly enough, it was born from all of the other pandemics that never happened. So we've been working on a pandemic plan for almost 30 years because every time one came up, we would start a plan, we would augment and change the previous plan. This one was born in 2009, and then we've since crafted and edited it and adapted it to 2020 and kind of got rid of the influenza conversation and really now focus on more of this concept of a pandemic and make it more universal so future kind of responses can be easier to adapt to. It's very broad, identifies thresholds for not only the community, but it also identifies the thresholds of the World Health Organization and state EOC and county EOC threshold that drive, excuse me, our thresholds. It allows departments, department directors, the fine staff that's behind us, the people who really are the driving kind of cogs in the wheel that get things done every day. It helps them and allows them within the framework of the plan to manage the business of continuity of government and not be restrained by specific check-the-box bullet points. And it directs the response as condition changed from when we started this process, we were at a 2 and now we're in a 4. So as things move along, it moves that in a steady pace and directs everybody in a consistent way to move the response in a different direction. And today, as the city manager said, we are currently at level 4 within our pandemic plan, and we can talk about that later as you ask questions. So I'm going to move a little bit on the community response, and I'm going to ask Chief Harsey, the police chief, to weigh in on some of this stuff.
Good evening, Council. Mike Harsey, the Police Chief. Just wanted to touch on a few points. As you all know, we have our own PSAP center, dispatch center, where we're receiving emergency calls continually. It's fully staffed and operational. The PSAP dispatchers are triaging any medical calls. They have a specific line of questioning they're asking callers, and then they forward that call to our friends at Hennepin County Medical Center, who dispatch for Hennepin EMS. Now, with that triage, there's a determination on what level of response is sent to a medical call at this time. Police department is not responding to any medical calls which present any signs of respiratory symptoms, and it's then triaged by Hennepin EMS, and they're making a determination whether or not fire should be responding. So it could be just Hennepin EMS is responding to these calls. So at this time, we have no changes in our police response to any other calls for service, only our medical response at this time. So we are, although over the last 5 days, we've been working on community mitigation strategies as outlined by the Minnesota Department of Health. We've put a number of those strategies in effect in the police department. And since the announcement of community spread starting yesterday, we've furthered that work and are taking additional steps to keep our employees safe and still continue to provide the level of service that our community expects. And like I said, we have not changed our level of service for calls for service at this time.
On the fire department side, very similar. We've been adapting as we go. Being the primary EMS responders, in addition to Hennepin County and the community, it's been hard for us to separate and move this process along a little bit with Hennepin County EMS. But we're making inroads, and Hennepin County has turned out to be a great partner. They have new leadership at the chief level and very collaborative. Comes from the fire service, natural born leader. And he has, so he's working well with us to try to determine the strategies. So we're working hard with them, our senior population mostly. Most of you remember Amy Lucht, our care coordinator for our community health management program. I've reassigned or realigned her responsibilities now. She's actually going to become a liaison for our EOC operations for all senior centers. So she's going to be working with each senior community and detailing on where they're at and working with them and reporting back through the process so that we can stay ahead of that population. And then community communications, I can speak to some of that, but we've asked, we partner with our PIO, Jackie Smith, and of course, City Manager Tom Harmoning. There'll be some things happening, on regular communications that occur because of an EOC. As the EOC sets up more full activation, there'll be more of a situational reports that are going to the state and all kinds of incident action plans that occur on a daily basis with the responders. And this will be, I think we're looking for Nancy Dino.
Hello, Mayor and Council. As for our employees, we want to support their well-being and healthy workplace as much as possible. So what we're doing is we've implemented some COVID-19 leave programs that extend an additional 14 days based on various situations, and also with the governor's closing the schools and daycare issues, it will be extended for our employees who need to support the efforts of our employees to stay home and take care of child care. With this comes the distancing of work, working from home if possible. Our supervisors and directors are working right now to realign work so we can continue to support essential services. We're also looking at shifting some work responsibilities to continue to further support the essential functions as they continue to arise, whether it's communication, call centers, outreach, police and fire needs, and some other essential needs. So we're looking at what's essential and what needs to be realigned to also distance our employees from the workplace for further exposure. So schedules will be looked at shifting of work and supporting. Now, this is fluid, so we're setting up these things, these programs in chunks as we move along. Tom did a really nice email out to staff on Friday. Since that time, it's changed again, and we're supporting the school and daycare portion of it, knowing that our employees need to work and we need to perform city services, and we want to try to do the best as possible in these ever-changing times to do the shifting and adjusting as we move along. So I'll leave it at that. You've got a lot of things coming up on your plate.
One thing I would add to that, thanks Nancy, is that, as I said earlier, we are going to be closing to public access the rest of our buildings. Last weekend, we closed our Park and Rec buildings. That doesn't mean we're not still going to provide services. Most or many services that we provide can be done via our website. For example, you can get a building permit off our website. You don't need to come in to get a building permit. Our staff is able to review plans from home if they need to, if we want to send people home. So we have a lot of capabilities via our website, our phone calls, email, WebEx. I mean, there's a host of opportunities or options for people in our community to use. However, I do want to make it clear that our focus is going to be on making sure we provide the essential services that our community expects. And what that means is that some of the more discretionary things that we do from a service perspective may not happen right away, may take longer, delayed. I think it's just important that you understand that and that our community understands that as well. I can tell you that our staff is going to try to do as much as we can, but given some of the constraints that we're in, there could be some things that just can't happen immediately. Some things that we're still going to maintain, at least for the time being, is point of sale inspections, because people are buying homes and interest rates continue to go down. We're still going to be doing construction-related inspections with our staff having protection, PPE protection. Those kinds of things that are time-sensitive and in a sense essential in terms of meeting the needs of our community, we're going to continue to do. What we're not going to do, for example, picking on Brian here a little bit, is we're not going to do our discretionary rental licensing inspection. So every 2 years, we get through every rental unit in the city. You know, that's discretionary. They don't want us in their unit, and we don't necessarily want to be in that unit. So that's an example. Licensing inspections, those are things we can slide or push off. They're not essential. So all of the department heads are looking at that to see and kind of triage those things that we need to do and those things that perhaps could be just put off a bit.
Yeah, did you want to get through,
Yeah, could we
Chief,
just
the
get through?
briefing,
That
and
would
then
be
we'll
great.
do all the, I know I'm writing some things down here as well, so.
Clint, do you want to come on up? I think you're next. If you're done, Nancy.
Good evening, Council. Clint Pyers, Chief Information Officer. Just want to speak briefly to what we might be doing for remote work. A number of our employees have been identified as potentially working remotely, approximately 150. The good news at a high level is 120 of those employees already, or 120 of our employees already have laptops capable of working remotely. So not all of them will necessarily be called to work remotely, but we've got a very good start on the equipment available that we need to help people work that way. As of today, as Nancy mentioned, departments are identifying employees that they'd like to be made equipped to work remotely. So that's a work in progress right now. We should have that list complete by tonight, and so we'll be working on that tomorrow. Department directors have been given the authorization by the city manager to let us know when they'd like those employees to work remotely and to make it happen. So we will do that, and some of that may even start as early as this week. We have increased our technical capacity for remote connections. As some of you may have heard of a VPN or virtual private network connections, and we have had a pool of those, use those for several years. What our provider has done for us in other cities is increase that pool dramatically so that we don't have to worry about the number of connections or running out of those. One of the things that we're trying to do as well is to equip our employees remotely as close as possible to the way they're equipped in the office. All right, if they're going to be as fully functional as they possibly can, they really need to have the same capabilities. And so that's been one of our overarching goals. One of the things that's upstream from us is this. We could have electricity, our network up and running, internet connectivity, and yet there are a lot of places that are hosting our applications. We don't run them locally. We're dependent on third-party vendors. Could be for storage. It could be for the software application itself. So part of what we've been spending a lot of time on is collecting information on their readiness for this situation or reaching out to them to find out what their readiness is, at least for the mission-critical applications. So the risk there is a risk that every organization is facing, is that you can have a lot of things in place, but it only takes one thing for the service not to work. So we're working very hard and diligently at that. So overall, our overarching goals are first and foremost, as we go through this and help people work remotely, whether it's delivering equipment, getting equipment, servicing equipment remotely, is keep all our staff safe, whether it's the IT staff or the rest of the city staff. It's getting the remote working staff as fully functional as possible and keeping them that way. And that's not just computers, that's answering the phone. And so employees who do work remotely will be answering their phones via computers and headsets. That's part of the full functionality. I'm trying to get that functionality to them as quickly and as efficiently as possible. And we're also trying to protect our city devices and our network from virtual viruses that could come from people's homes. So we have to protect now that endpoint just like our existing endpoints. That's one of the reasons that we're trying to issue the equipment that is a city device, not relying on home computers. And again, balancing that with the rest of the work, which is to keep the lights on here in City Hall and all the infrastructure working, because if that's not working and people have nothing to do remotely, it doesn't matter. So we're trying to balance all those overarching goals as best we can. One of the other things that we're heavily involved in is mail. Believe it or not, snail mail is still very important. And so we're working with the post office, as that's one of our responsibilities. We won't get into that tonight because it's not remote work related. However, be aware that's another risk area, and we hope the USPS stays healthy as well. So, yes.
Could you just talk for a minute or less on the technology capabilities for council to do remote meetings?
Sure.
And then Soren can talk about kind of the legal aspects
Sure.
of what we have to do to allow for that.
Sure, yeah, absolutely. So, and I read the enabling legislation that Soren shared with us, and it talks about audio capability, and I'm not sure how old that legislation is. So, in a nutshell, we can use a number of conferencing tools. Our common one here is WebEx. Set up a conference call is very easy to do. You could all participate in that conference call, let's say for a meeting from home, and you could have people in public places sharing that and hearing you and the ability to work. And I believe part of the legislation calls for the ability for people to come to a public place, let's say City Hall, if you were at home, having a conference phone here and being able to participate in that meeting if you wished. There's obviously audio-visual tools that we can use too. So if in addition to audio we wanted to use video capability, we can do that. We can display you at home if you have a camera or you want to be displayed. We can display on that people in this room. Part of what Jackie Smith is doing is working with her colleagues, because while we have those technical capabilities, it transcends that when we start talking about cable television as well. So what role will cable television have in that? And Jackie is working with her colleagues through her professional association. In fact, Jack, are you meeting tomorrow on that? Yeah, and so we'll have a lot more to report. I think that from a functional perspective, the biggest question for us is going to be, how do you want to hold meetings? We'll have a lot of different options. So the question is between you and Tom deciding how you want to conduct meetings, and then we'll find the very best possible solution to that we can. There are a lot of options out there that can help us fulfill the holding of meetings in consistency with state statute. Does that help, Tom? It was more
Yes,
than a
want to
minute.
cover the legal aspects, Soren? Thank you, Clint.
Yep. Good evening, Council. Soren Maddox, City Attorney. So the law allows, when a pandemic exists, that you can hold meetings remotely. Under the open meeting law, there's an expectation that you come into the council chambers, that the public is allowed to attend, not necessarily participate, but that they can be here to watch the work get done. There's a specific statute that says in the event of a health pandemic, you can meet electronically. All of the means that Clint has described would satisfy it. It still contemplates telephone, but I think we can get better than that. Beyond that, there really are no other requirements, so to speak, as long as the pandemic exists. It's been declared. You can meet that way. You have to be able to hear one another. Makes sense. The statute contemplates that City Hall is open and that the public can attend here and watch it and look at it. However, the statute does say that that's only necessary if it's feasible. And so if we're going to close City Hall because of concerns of people being together, I do think that we can close the chambers to the public while you video or however we choose to transmit these meetings. So I just think when we start to, if we go down that road and that's how we hold meetings, we're going to want to make it clear City Hall will be closed. We're still going to have our meeting. Here's how you can access and watch our meetings. As long as we do that, we'll be in compliance with the law.
Soren, we transact all sorts of different types of business at regular council meetings.
Yep.
Are we required for people to participate in the meeting remotely via email or Facebook or some other mechanism to comment during the meeting?
So are we required to? It's unsettled right now. So for example, you have a public comment portion of your meeting. That's almost assuredly going to be eliminated unless Clint can accommodate that from a technology standpoint. The only other area where that comes up is on your public hearings. Think planning and zoning items where we're statutorily required to have public hearings. We have to take a look at whether technology will allow us to do that. Normal function is to walk up to the dais, speak. We don't necessarily want the public to have the same access to the conference, say, as the city council members. That, you know, they're limited in time and participation. So I think we have some things to work through on that. But the idea is that remote meeting mocks what we're, or it doesn't mock it, but it simulates what we're doing here as much as possible.
Can you bring us home, Steve, so we can get to questions?
Yeah, so just a summary, I mean, this has been a lot of stuff, kind of whirled through it a little bit, but so leaving time for you to have questions. But right now, I mean, this is, as everybody keeps using the word fluent, if I hear unprecedented one more time, I'm gonna scream. But I mean, ultimately, these are times we've never experienced before, and all of us are trying to be very proactive in how we expand and do things. Next steps would be that we continue from a proclamation, if that should happen tonight, it would fully activate our Emergency Operations Center. We begin to just operate under the plan, both the Emergency Operations Plan and the Pandemic Preparedness Plan, to meet the needs of the community and to follow those guidance. With continued vigilance, this, you know, I don't know about you, but I spend most of my day between watching podcasts, webinars, websites, and there's just a lot of stuff going on. One of the things I think that I find most reassuring about this plan is that when you take a look at a plan is only as good as those who can execute it. And I think we're fortunate. And today at St. Louis Park, we have a very highly seasoned, very professional group of directors who have a lot of experience in their areas of focus, who are able to prioritize their work of their departments and to really understand, the priorities that exist to meet the needs of the community. And really the secret sauce of any plan is just making sure you can facilitate that in a way that just moves seamlessly across all the departments and delivers kind of in a way to the community that's seamless to them. And we want to remain as much of that as possible. And I think we have a team that can do that, and I feel confident about that. And then ultimately, we need to adjust as these conditions mandate and make difficult decisions sometimes about what we have to do. And then communicate, over-communicate, under-communicate. We can never communicate enough as to what we want to do and how we're going to do it, and be available if possible to answer those questions. So that's where I see us.
Anything else, Tom?
We are ready for questions, Mayor.
Yeah, there's a lot, and nobody needs to raise their hand. I'm sure everybody here has questions, so I'll work my way around the room. I guess there's a couple things that I just want to, a little bit of table setting. Number one is the governor had his press conference just now, and he's ordered at 5 o'clock tomorrow, all bars, restaurants, movie theaters, and fitness centers will be closed in the state of Minnesota. Minneapolis had announced something similar earlier today. I think they also had coffee shops in it. And so that's, I think maybe somebody said, maybe Tom at the beginning of this, or maybe it was one of the other conversations we had, it's like the minute you do something, it's outdated. And so I just wanted to hit on three topics that I just want to make sure that we get a chance to talk about. One is, we need to have a conversation about how we want to hold meetings. We as a council and with staff need to figure that piece of it out. Tom has suggested declaring an emergency as a city, that we declare an emergency. And I guess I want to get a little bit more granularity just about what does that do? Does it open up something? Does it allow us to do something that we otherwise can't do? Whatever. And then, because we do know that this is a fast-moving situation, I am curious, would like the chief to talk a little bit about, and us to talk a little bit about the next phase, right? Because everybody sort of says, like, France is 2 weeks behind Italy, and Italy was 2 weeks behind China. And if that's the case, and if San Francisco has now closed the city, they have ordered shelter in place beginning at midnight tonight. No one's allowed to leave their homes. I'm wanting to talk a little bit about those triggers and where those pieces come into play. I would like us to know, when do we need to make that move, rather than having to wait to have that conversation, because that would be a big step. But I have a feeling, unfortunately, I do have a feeling that could be something that we have to do. So I think it's important for us to just talk about that. So those are, we don't have to discuss those issues at this moment, but those are three things that I think at a high level, I'm sure everybody has lots of smaller questions, but at a high level for myself, that I want to make sure that we discuss. So Nadia, I'm just going to start with you.
So I just have a quick question regarding the COVID policy. It says that, or I mean, you said on your updates that any employee who is experiencing, COVID or is or gets sick, or a family member gets sick, they get to have this leave. Is it paid, and does it apply to part-time, or how are we doing this?
Yes, it's,
Does anybody else have mics on other than Nadia and whoever would be? Okay, great.
yes, it's paid leave. It's not just for contracting or exposure. It's also paid leave for school care and childcare, and if we find a self-quarantine, that's too. So it's basically an additional 14 days paid leave. It applies to benefit earning employees and then various classifications of our part-time employees based on the essential function of their job and the department head's recommendations.
Right. we'll have a chance to come back
Yeah.
around to as well.
Yeah.
Larry?
Yeah, so I have a lot of questions, but I'm also I'm cognizant of the time. And so I think I would like us first to say, what are the things we have to decide in the next 25 minutes? Right? Because that's what we have before the EDA. And because we're not going to get to, I think, everything. And also, I'm also cognizant of not wanting to get in the way of folks that are needing to do a lot of stuff. So I'd really like to know, what are the things we need to decide in the next 25 minutes?
That's why at least two of the three that I raised, I think those are right, this emergency declaration and how we want to conduct our work are at least two deliverables. I don't know if
I would add then, when do we need to meet again before next week?
Can we just do that tonight?
we can do,
I don't understand when we're discussing it, because you asked the question like.
Yeah.
we should talk, no, we need to talk about it now. We can talk about it right now if we want.
Okay.
So, but before we get, before we get to this, are there any other specific deliverable items that we want to make sure we get to? Yeah.
Yeah, I'd like to know about relief for residents, whether that's rent relief, utility relief, some more support for STEP, small business relief, some of the things that actually Tom alluded to in an earlier email, and how that works from a policy, I'm sorry.
Thanks, Jackie. So I think people heard me, but how we would, lead that from a policy perspective, if we're able to do that. And then I also wonder about a city hotline with various language options for people. So those two things, and primarily the policy stuff around relief for residents.
Okay.
I'd asked, it's Nancy, I've asked Soren to, Tim Simon can't be here tonight, our chief financial officer, and we were looking at the financial considerations. So it's one of those, it depends, and there's some technicalities with it. Certainly we can figure out what to do. It can't be automatic. Soren can address just a little bit to that. And then for the call lines, Chief Coring has said the EOC would have us set up various call lines, but it's going to go to the basic information so we're not confusing residents. So, Soren, you can address the financial?
Yeah, so for example, what the charter contemplates is that if you're required to establish a budget, and if you want to alter that budget, there is a process for it. Your charter does contemplate an emergency situation. You can go into whatever you've set aside or is in reserves. So we can take a look at that in terms of what you want to allocate those funds for. The second part of that is relief is a big, broad basket of various points of need, if you will. And so what we'll have to also take a second look at is public purpose expenditure. What the state has said is cities, you can spend on some things, but not others. So relief, yes on some things, perhaps no on others. And so I think we'd want to drill down a little bit about what it is we're looking to give relief on before we pledge those dollars. But I think we can get there on most items.
Yeah, that's exactly the kinds of questions I'm wondering about. And then the last thing I forgot to mention, I've just heard that they've been doing this in Minneapolis, water shut-off, not allowing water shut-off, and I don't know anything about how we would mandate that as a city.
I think that Cindy's can take that under operational consideration, being the Director of Operations and Recreation and in charge of all of that. And I think she's already taken the practice of relaxing that right now and for the time being.
Cindy, do you have anything more that you want to add other than what Nancy just said?
What Nancy said is correct. We will not be doing any automatic shut-offs.
Got it.
Unless for emergencies.
All right. Other big, high-level questions? Yeah.
All right. My question is, Steve, you had mentioned that we're currently at level 4. And so you've shared amongst with staff, or staff has shared what that looks like in terms of operations. What could we anticipate if we move to level 5, for example?
Okay. Hold on one second,
Yeah.
Chief, before you answer that. Any others? I just want to Ann.
I want to make sure that we are providing, and I'm not sure, I've glanced through the resolutions, but I'm just seeing for the first time in the moment here, that we are providing sufficient authority, and I would say maybe we can come back to what that budget would be, but also sufficient authority to the city manager with notification to council to waive the rules and regulations of whatever those requirements are that we control in order to effectively respond to these situations, that we've put some broad authority in there so that he's not waiting for the council to convene in order to manage a situation. Yeah, sure.
Hold on, Soren. We're gonna collect all these up and then we're gonna hit through them, but I guess I just wanna make sure we know the scope of it, but we do need to get to answering these, because we don't only have 20 minutes.
The one,
We'll take time.
Yeah, we could, yeah, I understand.
the one other big area for me is, how's it going with the school board and what assistance might they need from us?
Yeah, and if we have to go a little longer,
Yes,
isn't that okay?
that's true, that's true.
Yeah. I had a part two question, that is, given that we're looking at our city operations and only doing the essential functions, I'd like to see that happen with our council agenda topics, that we choose the ones that are only essential for now and not continue at the same load that we've been doing at past meetings.
Anyone else?
And Jake, the last item is, I just want to amplify what Margaret said about the relief for utilities, for other kinds of things, again, that the city can control and manage. Even though, as we do that, I understand that we also have to create a plan, because a part of that is kicking the can down the road in terms of what those issues then create. But I do think that we need to ensure that we are providing, so like when we're being told that we can do utility shutoffs will not be enforced, I think those kinds of things need to be a little bit more documented and communicated to residents so that we understand that, they understand that.
And I'd also like to amplify the small business piece, especially in light of the information that we received today from the governor. I think that's going to be an urgent need for some of our little businesses, and to understand what resources are coming available, if any, through the federal government, state government, and figure out how, we can, and what's happening with that so that we're aware.
Yeah, I think elevating these issues, yes, I don't know that we're gonna answer them tonight, but I think, yes, elevating those, making sure that they're on radar. Yeah, Nadia, did you?
I was just gonna say as well, like, yeah, because I'm not talking to you guys. So I also, like, this is very odd that we're talking about this, because one of my first sessions in DC was emergency management, and it was my favorite, all because it like talked about structure, and it also added like some of the equity portion to it, which was a breath of fresh air. And as we're talking about this, I really want to make sure that whatever we end up deciding and whatever the updates are, that our underserved communities are really having that access, and we're having that constant communication, and the testing as well, anything that we really decide. Because I'm thinking as we're doing this, I'm trying to like figure out like where are some like testing places in St. Louis Park, or is it on the city website, or things like that, like the structure wise. And I'm coming from a side of like, if I wasn't a city council member, would I be aware of these? Knowing that, speaking for my community, I can't speak for any other community, but we are very like close knit, and we're rarely aware of what's going on outside, and so I really want to make sure that we're reaching into that. So, yeah.
All right, they're in a particular order, just because, as I view them, but in terms of their importance, so just maybe sort of, working through this list. Let's start with how we want to conduct our meetings moving forward. One of the questions, I guess, that I had, oh, I'm sorry, Tim, did you have something?
I was gonna comment on your top two, and I'm trying to move on.
Okay. So the question for me is, how do we want to conduct our meetings? I guess I had some questions about trying to figure out how the public, in those instances when the public does have, and I don't know that we have public hearings on our agenda coming up real soon, I don't remember. Those are really the moments. Otherwise, it's really just, televising it or broadcasting it so that the public can make sure that they see it, whether that's live streaming it, or if we, all end up setting up a council Skype that is specific to council meetings that people could, listen into. So, Tim.
Thanks. First, I want to thank all our staff for all the heavy lifting you're doing around this. I mean, I'm sure you put in lots of extra hours and lots of effort on this, and will continue to do so in the immediate future. So I know our citizens will owe you a round of thank yous on that, even if they won't come out in person to be able to give that to you. So, thank you. As far as the remote meetings go, I trust Clint and Tom to work the mechanics out for us. Obviously, we'll have to set up some type of opportunity if this goes on for a long period of time for public information or input on our public hearings and other things. But we can develop workarounds for that as we have to and trust the staff to do it. As far as the emergency declaration, I'm certainly in favor of issuing that today. Give our staff as much authority as they need to be able to respond to these things. We'll meet soon enough to be talking about additional resources that have to be allocated as the demands are there and as we sort out the demands, because there's going to be a lot of them upon the city and our state and federal government. So we'll do our best to do that. As far as essential services go, I was home with one particular citizen today who had 3 young children and absolutely viewed it necessary to get out into one of our public parks and run those kids for a while. We're going to have a lot of people, especially in multifamily housing, where they're going to have to get out. There's going to have to be some type of exercise or recreational opportunities for them. And the person I talked to said, you've got to have the bathrooms open at all these facilities because there's going to be kids there. It's going to happen. So I'd suggest we want to look at how we can facilitate that, how we can keep them clean, which is obviously a paramount demand. And at least from this citizen's point of view, and mine too, that's kind of an essential service that we'll have to have given the future we have, which looks like a lot of us are going to stay close to home, but you can't stay home 24/7, I don't think.
I live by a park. I've seen that too and agree with what you're saying, Tim. If we could make that possible.
I mean, I guess I would agree with Tim's assessment. Like, let from a technology perspective, I think as long as you all are thinking through the transparency and making sure that when we need to, there's a way to make sure that the public, whether it's asking questions on Facebook, if we're, I don't know what it is, but making sure that that piece is available, I guess would be, yeah, Larry.
So, I would agree. I have a little bit of maybe an advantage for most of the past 5 years running a remote organization that supported people around the country. So I would encourage to add one piece that I think we should do things over video, especially amongst ourselves, and that there are platforms, I'm sure Clint is aware, that would allow good public participation either via video or via teleconference in that kind of thing. So.
Yep. Anything else on that? Yeah, I sort of half joked late last week that probably one of the most nervous people in America or in the world was the person who runs Zoom meeting, because everybody was saying, well, we'll just use Zoom meeting, and I'm sure that there were questions about capacity. Yeah, Tom.
Just one real quick thing on meetings, and I think Councilmember Harris spoke to that well. We need to think about study sessions where we usually roll up our sleeves and it's an in-depth discussion. This coming Monday, we have a study session scheduled where our crime-free ordinance was on the agenda, and we were going to be looking for interaction between members of the task force and the council about that ordinance. And a couple of other things on there that weren't quite as critical. My suggestion, but this is up to you, is that we cancel that meeting and reschedule it for a later date. The ordinance itself is under suspension, so to speak, so nothing is changing there. I think it could be really difficult, given the interest and passion around that topic, to try to accommodate feedback back and forth on that, because it's so important to people. So, so that's the only point I wanted to make.
I think I would agree with that.
Yeah, I would agree with that, I think.
Yeah.
And I think, Rachel, I think, made a really excellent point about really, triaging city services. We're gonna have to sort of triage what's really reasonable and doable for the council, especially when, I know I benefit greatly from having that opportunity to sort of hear from my colleagues in a really good and robust way. And certainly in that instance, where we're going to be going back and forth between commission members and members of the council, that would be virtually, it's hard for me to imagine how to manage that. Yeah, Ann?
I would say I can support that as well. I think it's important how we message this. Next Monday will be our first attempt at a remote meeting. And I think that depending on the duration of how we function this way, we will become hopefully more skilled in doing this, or it will end soon. But either way, a couple months from now, we will be better equipped to have a more interactive conversation about it, and that should be the message as opposed to just indefinitely delaying it.
Right. Yeah, Larry?
Yeah, so I want to agree. I'm fine with that as well, but I would say it is very possible on a video to have an interactive meeting.
Yes.
Like this. So it's very possible to do, but I wouldn't want to do this being our first one.
Absolutely.
Okay?
Yep.
But we should, you know, I wouldn't want to say we put this off until we're not on over video. I don't think that's okay.
All right. Yeah.
And just to kind of go back to what this does, the declaring, does that mean that what our council member Mavity was saying earlier on, that Tom will have some sort of power over deciding, you know what I mean, and just notifying us, which I am perfectly okay with, because you can't, this moves so fast that you can't wait for us every week to reconvene. I think I want to have a conversation around
So
that as
that
well.
actually was the second item on my list.
Perfect.
So congratulations, you read my mind.
Yay!
So what does, you know, and it's the piece about the declaration as well as the sort of more plain-spoken question that's been asked about giving the city manager authorities. Yeah, Ann?
Before we do this, I don't know if it's possible to either put this up, again, I've seen this for the first time, if people are watching, we either need to read this word by word, or I think we need to have it up on the screen so that our viewing audience can see what we are considering in the moment. So one way or the other, I think we need to make sure people understand what we are considering in the moment.
Probably the easiest is just to read it. I don't know that we've got the cameras set up that we can show it, so I'll just read it.
Okay.
It says, proclamation declaring a local emergency. Whereas Jake Spano, the mayor of the city of St. Louis Park, the mayor, finds that under the authority provided in Chapter 12 and related laws of the state of Minnesota, the following situation exists. Peacetime emergency due to COVID-19 health pandemic. Whereas the governor has issued Executive Order 20-01 declaring a peacetime emergency and coordinating Minnesota's strategy to protect Minnesotans from COVID-19, which would be attached to this document. Whereas the mayor finds that the situation presents an unforeseen combination of circumstances that is sudden and unforeseen and could not have been anticipated. Whereas the mayor finds that conditions in the city of St. Louis Park, Minnesota have worsened considerably as a result of the evolving situation. Whereas the mayor finds that the situation threatens the health, safety, and welfare of the citizens of the community and threatens the continuation and efficient delivery of city services. Whereas the mayor finds that the situation poses a risk or may cause extensive personal injury, damage, or disaster to the city if not immediately addressed. And whereas the mayor finds that the traditional sources of relief are not able to repair or prevent the injury or loss, it says, now therefore be it resolved, the mayor of the city of St. Louis Park, I do hereby proclaim this emergency effective at, and it offers a time, and then says March 16, 2020. This declaration of a local emergency will invoke the city's disaster plan and authorize other appropriate community containment and mitigation strategies. The portions that are necessary for response to and recovery from the emergency are hereby authorized. To the extent that normal state laws and city policies and procedures impede an efficient response or compliance with federal and state directives or recommendations, the city manager, emergency management director, and designees are hereby authorized to suspend compliance with those laws, policies, and procedures as authorized by the governor's declaration and Minnesota State Statute Chapter 12.32, and to take those actions deemed necessary to protect the public health and safety. Wherefore I set my hand and then I sign. So that is what it says. I think the most important part is that last paragraph. Yes, Ann?
And just to note as well, is our disaster plan currently accessible through the city's website? And if not, I think it should be on the front page of the city's website, since we are referencing its authority in this document.
Chief, is that a public document? Or is there security information that's contained within that document that would either need to be?
Yeah, it's, the emergency operations plan of the city is not a wide open, publicly displayed document. For those reasons, there are things which direct work, staffing levels, things like that within the plan. I'd have to consult with my peers to see how they've solved this problem in other cities.
Okay.
I wonder if there's a summary of it
I'll validate with,
or
try to get a
redacted
consensus
copy.
amongst, it's not the first time it's come up, I'm sure.
I also know, I also want to be respectful when we ask for like a summary or a redacted copy, that you're in the middle of trying to do an emergency, but I understand and
interest, yeah.
exactly the interest of public transparency, making sure folks know what that all means. Other questions, thoughts, observations on this? Yeah, Larry.
Yeah, so just a question. So by doing this invokes the disaster plan? Is that by doing the local emergency?
So what this does, by the mayor declaring this emergency, what it does is it yes, it opens up, it basically creates an opening for our community to be part of this emergency at the county and state level. So be recognized as a community that is recognizing this as a problem. So when we go out and look for resources, if we become part of discussions around through our logistics and planning section, we are basically validated as a community who's in need because of this declaration. So it's an important piece you have a presidential declaration, a governor's declaration, and now the mayoral declaration. It just finishes it, puts a bow on it, and makes sure that the city of St. Louis Park then is eligible to participate in those things. And at some point, if there are future reimbursements, that this declared disaster then becomes a tipping point for how we track and move forward from this point.
Okay.
Does that make sense?
Thank you.
I think there's some other advantages as well. Maybe Soren could just quickly summarize those things.
Right. So as Steve said, the first is you're acknowledging the emergency, and he's discussed why that's important. The other aspect of it is, there are certain rules and regulations for how governments can enter into contracts, things of that nature. What this is a recognition that, look, because of the nature of the emergency, we may not be able to follow the letter of the law in all of those items. It's not an excuse to ignore those things, but there are times where just speed demands that we just enter into certain contracts.
Normal operation might be to get 4 bids on a project or 4 bids on a request for something. Something like this might allow the city manager to get 2, or say, here's somebody who's already on site doing the work, the price is reasonable, I'm going to go ahead and, something like that.
Yes, that's exactly it. And then just it acknowledges that there may be some things we haven't thought of yet, that there are certain procedures and protocols that are in place that we're expecting staff to follow when all of a sudden something comes up. Hey, we need to get this done. We haven't ever done it this way because of these protocols. If we're ever asked, well, why did you not follow those rules? Look, we're in a state of emergency. We're not, this isn't an abuse of discretion. The action needs to be in response to the emergency. This isn't for all business. It relates to the business in response to that emergency.
Yeah, Tim.
I've got one question on that with respect to the scope of the authority then. I certainly respect the need to give the city staff the authority to do what's necessary here. If we get to the point where, like San Francisco, we had to order everybody to stay in their homes, would this give the city manager that authority, or would that require some more direct action
point,
by the
good
council or the state of Minnesota?
There's a separate law in Minnesota that deals with quarantine. So my understanding is the state would come out and ask for voluntary quarantine first. There is a procedure, but it's initiated at the state level. Thank you. And just to be clear on the scope, what this is meant to be is a continuity of services. It doesn't somehow suspend constitutional protections and things of that nature.
Right. Due process still
Yes.
applies. All right. Other questions? Yeah, Ian.
My understanding, if I'm recalling correctly, is that right now the city manager has authority to make financial decisions up to $100,000. Is that correct?
It's up to 175 now.
Oh, it's up to 175 now. So one of the questions I would have is whether that is seen as adequate, if we need to authorize, whether it's a one-time or some kind of a notification or something.
Or does this do that?
Or does this do that?
This does that.
Okay. And then, so is there a required notification? I would assume that there's a implied notification of the city council and others.
Yeah,
Yes, please.
I will definitely be communicating with
Yeah.
you. You're going to get sick of hearing from me. I don't want to do anything that would cause a problem,
course.
especially later on. So yes, I would certainly do that.
Okay.
Mark?
So the next opportunity we'll have to make decisions is 2 weeks from now, right?
Unless we were to
Oh,
call an
3 weeks from now.
emergency- Unless we were to call an
An
emergency
meeting.
Yeah.
That is
Okay.
correct.
So 3 weeks from now.
Yes.
So are there important decisions we need to make well, we kind of laid the groundwork for that. I guess I'm thinking about STEP. I'm thinking about the question around relaxing some of our rules around the rental housing assistance and things like that. Are those things we should be talking about tonight as well? Or are those things you're having the discretion now to decide on?
What I'd like to suggest, because Derek and I have not had as deep of a conversation as I'd like to have, including some of the legal considerations, if that could play itself out just a little bit. If we wanted to help Steph, maybe we do it incrementally over time versus all in one shot. So if you wouldn't mind, if we could just talk that through a little bit more, I would appreciate that.
Sure, as long as there's awareness and we don't have to wait 3 weeks, but, yeah.
Yeah, Ann.
In terms of the city business, the other question I have is making sure that we understand what constitutes a council quorum in order to function, so that if several of us were unavailable for whatever reasons, at what point does a quorum just keep getting smaller, or at what point do we need to think about that?
So the way it traditionally works is your quorum is 4, and the only way your quorum shrinks is if the size of the council shrinks, which would take a conflict of interest. So merely being absent doesn't shrink your quorum. So if only 5 of you are here, it's not like a quorum becomes 3. Your quorum is still 4. If you had 5, it still takes that 4th vote. So unless there's an absence or a conflict, not an absence, but a conflict of interest, your quorum is 4.
Thank you.
By the way, I apologize, I was having a bit of a sidebar for 1 second here with Rachel. I'm glad to hear that, and I would not support or have any interest in changing that aspect of it. So just to be clear, I don't know that we're.
It's charter, right?
Yeah.
That we're there yet, so. All right, so I'm going to come to Rachel. Thank you for raising STEP. I know Rachel raised it, I raised it. I'm sure that a lot of us have emailed a lot of people, or Tom rather, on a lot of these items, so we'll come back to that one. Go ahead, Rachel.
All right, thank you. My question is related to communications. There are a couple of us that have newsletters that we send out to hundreds or so people. I have a request from our communications team that would you share a paragraph of relevant information or links that we can send out to the residents? And, is that something that you're up for?
So 2 things on that, Councilmember Harris. First, we are going to be doing daily electronic briefings, if you will, on our website under the coronavirus tab. Some days it may say nothing new, in essence, and in other cases it may not. And I think that might be a good place where you could grab something if you wanted to, and get it out there. I would be just a little cautious on sharing maybe everything I might send to you via email, although it's I presume, public data. So that's one possibility for you. Second, and the mayor raised this, Jackie has prepared a a shared statement from the council that covers a lot of what we've talked about. That would be another piece of information you could use to share with your constituents. So that's going to be coming out here.
All right. Thank you. I have a follow-up question to that. Much like many of our other topics for city business, there's an opportunity to sign up for emails on that particular topic. Is that what you're doing for coronavirus, or is it simply something on the front, on the homepage?
Can you handle that, Jackie? Would you mind?
We have obviously the homepage that links to a page specifically about coronavirus and has all of the updates, and we'll continue to refine that page as we keep adding more data to it. In addition, we're doing some information out to the community to make sure they sign up for the tools that we already have in place, which includes Park Alert, My St. Louis Park, GovDelivery. And GovDelivery is the place where people can sign up for news alerts, which is where we'll be sending out information about coronavirus.
That answers my question. Thank you.
You're welcome.
Ann?
Two things. One is on communications. The situation is changing so rapidly, which makes it very challenging to put things in writing and send them as opposed to electronically. And at the same time, I'm not sure when we catch a breath and send something out. It feels like something needs to be sent out for the households that don't have access, and whether that's in the utility bills I know we've used in the past or some other means, but I want to make sure that we are at least alerting folks to where they can get information, just because not everyone is constantly checking obsessively online in the way that some of us are. And then the second thing I just want to say is I know, and in our communications, I know we all, you alluded to this earlier, we all feel this, and I hope it's communicated that, I mean, our focus is on the safety and the health of our staff and of our community in responding to this. And one of the things that I've just been so impressed with is neighborhood to neighborhood, what a wonderful response is emerging out of all of this. And so as we communicate out, I mean, we are communicating the city's business, and part of the city's business is strong neighborhoods. And I think the more that we can communicate that in terms of encouraging folks to do that, I just think is great. I hope that the win, whenever we're on the other side of this, is actually a much stronger knit community with a much stronger sense of unity than we've had in the past.
Thank you, Ann. I agree. I have two quick things on that. If we're going to send something out, I highly recommend a postcard as opposed to a letter that, you know, just directing people where to go. I think it's much more likely to get read. I'm hearing people say that. And then I appreciate what you said. It's a segue to a question that I was having, though, around people wanting to help. I've heard stories, wonderful stories, of people making sandwiches and putting them in a cooler on their porch. And I wonder if there's any, you know, which I'm not sure, you know, about I'm not sure if that's a good idea or not. And so I just wonder if there is a need or opportunity at some point to be providing advice to folks about how to help, the best, safest ways to help. You know, whether it's donating food to STEP, but not necessarily sharing food or delivering. I've heard people, you know, offering, again, wonderful offers. People just really want to help to feel better. But what's the best kind of help and what's the safest kind of help? I think people could benefit from some messaging around that.
Chief, could you just speak to that real quick? Because
Yeah, so
you and I had a back and forth with.
So you're right. This, you know, charity and I think the governor's even said Minnesota is recognized as one of the most giving states, and all that's really great. And the energy around community outreach is great. But during this particular event, this pandemic, it's very critical, hugely critical, that this energy around volunteerism and support is guided and directed in a very intentional way. And by that I mean is that it's important, if we're going to ensure the safety of our residents, ensure the safety of the other residents they're connecting with, that we direct and guide those volunteer efforts through our Emergency Operations Center, through our volunteer coordinator, who then, helps set up, because volunteers need supervision, they need
Right.
PPE, they need direction, and that's something that comes out of the EOC operations, and we can help support that. Right now, my guidance to everyone who calls and wants to help is the best way you can help is to wash your hands, stay home if you're sick, manage social distancing so that you're healthy when we need you. Because we will need you, we just need you healthy at the time it happens.
Yep, Nadia.
I'm really glad that you guys are touching up on that, because that is something I wanted to say as well. I've also seen that in times of disaster, we forget to act like a community sometimes. Like we, like you said, people are, or I mean like on one end of the spectrum, people are out for themselves in terms of buying like an insane amount of toilet paper or, like I would just caution people, don't buy beyond your means. Save the rest for people that are in need. And like, again, like acting, or I mean, sometimes being the best or helping out just means staying home. Or, there's FaceTime, there's all types of ways that you can check up on people. And I also would like to say on one end, and this is specifically for religious groups who are going to mosques and synagogues and things like that. I know that for Muslims on Fridays is a holy day, and so we go to the mosque and things like that. And so in this time, in this disaster, or I mean like in today's disaster, yeah,
yes.
thank you, yeah. Maybe it's best if you stay at home, and I know that the prayer will count just as much if you are home. I think there's a lot of things, health and safety trumps a lot of things. So, yeah.
Well, I think, yes, and I think the Archbishop of the Archdiocese said the same thing, right? Sort of Mass is optional for Catholics, and I think everybody is sort of getting to that place. I do want to get back, though, to one of the ones that was, one of the questions that I think is important. I just want to make sure we have a dialogue about it, which is the next level. And I'm wondering, Chief, if you can share with us, and Chief Harsey and Tom, talk to us a little bit about how do we know when we're there? I mean, I would imagine just as soon as now all the bars and restaurants, fitness clubs, movie theaters are closed, I can easily see somebody tweeting at me about, when are you gonna have a shelter-in-place order in St. Louis Park? And since San Francisco just did it, I want to just make sure that we're having a conversation about that and get your thoughts on it. I'll start with you.
Thank you. So that's been a question that has been bantered about a lot, right? What's the threshold? One of the concerns about those thresholds are that it can be very subjective, and it really drives a lot of energy and emotion, but it also needs to be based on science and fact, I think, and we're struggling with science and fact right now as it relates to cases in St. Louis Park. We are not able to get that information from the Minnesota Department of Health. We're not able to, they report incidents by county. And in conversations, I've had several today with that, they do not report by community nor by population. And so what we have is we really don't know in the event of community spread, when is it a problem in our community? If we had a significant community spread within the city of St. Louis Park, that would be an immediate call for action to do some of these things. So we work off of assumptions, and we don't want to move so fast that we use other people as our guideposts. We try to benefit from their knowledge and kind of their bandwidth, but at the same time, we have to look internally at our own operations and understand things. So to move from 4 to 5 is not a hugely significant change in how we deal with the services, other than it pretty much cuts off the person-to-person contact within the conversation and does it more telephonically or through some sort of connection electronically, where possible. You still have water main breaks, you still have structure fires, you still have those things which need to have response, and so it sustains and maintains those things. But I would have Chief Harsey address some of the changes to give you a sense of how it would look on the police side at level 5.
Thank you, Steve. Technically, we're in level 4, and we are currently evaluating our response to all calls. I stated earlier, we haven't changed that at all at this point. But we are monitoring it very closely on our number of calls for service and those types of calls for service, and reflecting on how much staff we have available to respond to those calls. We're not immune to sick leave. We're not immune to people coming down with the virus or the need for childcare. So we're doing our very best to monitor that. And as we see either the increase in the number of calls for service or the decrease in our ability to staff those calls for service, we're going to have to make a determination on when we change our level of response. We have a plan in place on what that response level would look like. Non-emergency calls would be, right now we're currently doing some of that with taking phone reports and those kind of things telephonically, but there would be a significant change in what we respond to. For example, residential alarms, we may not respond to those calls, depending on the level of service that we need to maintain.
I'm sorry, Chief, currently, or if you move to 5?
If we move to 5.
Got it, okay.
There'd be some changes in that level of response in a number of areas. And I'd like to make it very clear, if and when we had to do that, we would have to communicate that very closely with the community so they understand what we're going to be able to respond to and what we will not be able to respond to.
Yeah, Nadia.
Can you give me an example of what you'll be able to respond to versus what you won't be able to?
Well, the priority would be towards in-progress calls and calls of violence. Obviously, we're going to respond to all of those things. Serious traffic accidents where there's injuries. If you have a fender bender in the parking lot, we're not coming. If there's a property down or a personal injury accident, we'll be there. We'll still continue to provide the response to medical emergencies, again, taking out the respiratory symptoms calls. But basically, it's going to be in-progress calls, calls of violence, emergency-type calls. Things that can wait, or is just a report, or not an emergent issue, are going to take a lower priority.
Chief, did you have something on that?
Yeah, I was going to add too. So every department within the city has those things which would be considered critical to deliver, right? So at 5, those things which are critical, like a water main break or those things. So each director is working around understanding staffing and how to split staffing and manage staffing, and so that those things can still be addressed. It will be those things which are on the outside that don't direct or need immediate attention or require urgent or emergent help. Those were the things that typically would be gone in 5. But every director has something underneath their responsibility that's going to take a change in response when we go to level 5. And I think it's imperative that, within the emergency operations process, level 5 is really at the point where you're supporting the needs of the community through a lot of planning process. Our planning process will start to look out not just tomorrow, it's going to be looking out a month, 2 months, 3 months out. So that planning process directs a lot of this conversation. And I would also let you know that I think it's imperative for you to understand that even though our staff is highly motivated and wonderfully engaged, they only have so much gas in the tank. And that eventually we're going to, if we're operating under 12-hour operational periods, we're going to run out of gas, and we're going to have to be using a variety of compacts and support staff from our mutual aid and through other resources brought in through Hennepin County and the state. So but the framework of the emergency operations plan and the functional annexes that belong within that just direct that work and keep it under control.
Larry?
Yeah, so what are the kind of things that would cause you to go from a 4 to a 5? A few questions. And then the comment you just made, is that the situation that we're in now, where you're going to run out of gas, or is that if you go to a level 5?
No, today we're not, no,
Okay,
we're not,
right,
we're nowhere
right.
near that. We have.
Plenty of gas in the tank.
There's
Yeah,
plenty of
yeah.
gas
All
in
right.
there. But this is, you know, when you talk about an emergency operations center being sustained every day for 12 hours a day with staffing who are doing their regular jobs in addition to sometimes managing their roles within the emergency operations center, it just, after a while, it takes its toll over. And I would say that as I think about this, I'm thinking 3 months, 4 months down the road. This is not something that I'm thinking is going to solve itself. It's going to be 3 to 4 months, which is a long time in maintaining and sustaining that level of input from our employees. So the system is designed to help alleviate that, and all the cities will be dealing with the same thing. The thresholds that move us from a 4 to a 5 are really those things which by their very act are creating a need for us to not be able to operate within a single operational period or be able to direct an immediate response in a way that sustains that safety for the responder or sustains that safety for the resident. If we were to find out that, you know, we had a cluster or a major area of exposure or confirmations in our community where we would be dramatically concerned about community spread, then we would definitely, that would be something, all those things would direct our conversations towards, should we do that? There isn't, it's not a check the box or it's not a, you know, if this, then this kind of behavior. It's really, it's understanding where you're at in the current trend, and if you're at that point where you're no longer able to sustain operations or you need resources beyond local control, that's what drives a lot of those things to move to the next level, because it triggers then additional attention and resources from other parts.
And just one, is there any chance that the Minnesota Department of Health will share with us data at a city level, or, and if not, is someone at Hennepin, they do it at a county level, is someone at Hennepin County looking at this to say, should we go to a next level?
Well, hopefully if they paid attention to my email. So one of the things that I'm most concerned about, and I, you know, would say that the big concern I have with the lack of communication is our senior populations, and that is if you receive a confirmation within a senior population, my concern is how do we know that so we can control that? The state, the MDH has said that it shares data with Hennepin, when it only shares data with Hennepin County Public Health as it relates to we have a case in Hennepin County. Hennepin County is not able to get data from MDH that's specific by patient. Now, nor is the director of the nursing home allowed to get that information. So what the system relies on is the self-reporting of the individual to say, to call the fire department, to call their director of the nursing home, to say, I've been diagnosed and I'm a confirmed COVID-19 patient. That's what the system relies on to being notified at the local level. If the patient does not do that, there is no notification within the local side of things. And so that's what we're trying to, and I think just like everything in this dramatically, rapidly changing environment, I think there's going to be some direction about that still allows people to conform to some level of HIPAA and confidentiality, but at the same time direct response towards the right area to control and contain if we're truly looking at controlling those exposures.
Rachel.
Chief, you mentioned that you anticipate 3 to 4 months being the duration to sort things out. Is that under level 4, of course, pending additional news?
So now I feel like Dr. Fauci. Is that, so when I say 3 to 4 months, I'm thinking that it could just as be easily 3 to 4 years. I mean, I have no idea. I think what's important to understand is that I think the community is catching up. The community is catching up with the realities of this particular event. First response, local governments are catching up with it. And I think the sense that we'll rise above it and we'll beat this thing down is, I think it's good if we if we build some social awareness and some expectations around, you know, this is gonna be a marathon, not a sprint, and that, you know, if we think to ourselves how we can underpromise and overperform, I think that's an important quality to have, because it is gonna get worse before it gets better, because we just know it will, because it's gotten that way everywhere else, and so we just need to be prepared for that, and then think about how we sustain the energy and the passion and the drive to keep doing what we're doing to make this, you know, to recover, because the fourth, as I'm sure Councilmember Mohammed would tell you, the fourth tenet of emergency management is recovery. And recovery is the most, you know, a huge important aspect of why we do what we do, because this city has to survive on the other side of this, and we have to do everything we can to frame that.
Thank you. My interest in bringing that up is much of the notices we've seen regarding school closures has been like till the end of the month. And it hardly seems that we could overcome what we need to overcome in that short amount of time. So what I'm wondering from a transparency standpoint related to city operations is it worthwhile to tell people a short amount of time, like we're gonna or check in on it in 3 weeks and reevaluate, or is it better to give people the sort of longer term forecast that it's 3 to 4 months of changes? Don't know.
Well, I would tell you my personal opinion about that is that I think because things are rapidly changing now, that it's better to have check-ins more regularly, because then it becomes more relative to what they're hearing. A long-term projection of when we'll recover with changes only makes it seem confusing. So I think each time we do this, we're gonna get more realistic, because we'll have more information about what the trends are, and so it becomes less of a swag and more of a projection, and I think that's important. But I think you need to keep it updated, because people are just being inundated with data now.
I appreciate, Chief, the appropriate use of swag, knowing that term. I want to make sure we get, I know folks have a lot of questions that they want to hear about, and I also, though, want to make sure that we're staying kind of focused on the biggest ones. I know I was asked, I think Margaret asked me, sort of whispered over to me about the schools, and I know that Tom has been in contact, as have I, with Aston and Mary and others, and the chief has. And so maybe just a quick update, obviously not speaking on their behalf, but I know that the two of you have been having a lot of conversations with them, and of course it's, you know, I think the last time I had an interaction with the superintendent was yesterday. Was like, all of that's absolutely irrelevant today. So with that, maybe Tom or Chief, if you guys want to speak to that.
Mayor, I'll take a crack at it initially. So we're in contact with school personnel, including the superintendent, all the time. One of the bigger concerns they're trying to work through right now is making sure that all of their students will have the ability to access online learning, which presumably not all students have available. So Jackie's been doing some really good research regarding offerings that Comcast has to provide those that may not have the ability to access the school's online learning system. I am not able to speak to how they're going to do that. I don't know that yet, and I know today, like us, they had a major staff conversation about this and many other things having to do with school. For now, they're following the governor's advice, and they're staying closed until the 27th. I would guess before that, we're going to hear whether that date should be extended or not. So that's really all I have from my vantage point. Steve, did you have something you could add to that?
Not really. I know that the conversations I've had with them, it's really all about them trying to understand how to staff and manage this crisis within the walls of their building, and understanding that how to sustain that response and sustain that oversight of this operation over an extended period of time. So In the Emergency Operations Center, schools are considered, they would be a component of our concern, and the liaison between the city and the school would exist so that we would be exploring ways to help support their response as well as their recovery.
I know that, and let me get to you in 1 second. I do know, first off, thank you to both of you for that, right? The kids that are in our school, whether they are from St. Louis Park or not, is irrelevant to us. Those are our kids, and we want to make sure that they're looked out for and protected and cared for. As the spouse of a St. Louis Park public teacher, obviously this is really important to me, and I will just say again, this could all have changed since this morning when my wife and I kissed each other and said goodbye for the morning. It could have changed, but I know that the focus of the time that they were to be out was to talk about coming up with a strategy for distance learning. And so my sense of it is, and that again could have changed, but my sense of it is that this window of time that they are closing schools is not necessarily for distance learning as much as it's to plan out a strategy maybe for the balance of the year. So again, that's above my pay grade, but that was kind of the sense that I got from that. And then the only other thing that I wanted to mention, because it came up in an email from a constituent relative to this issue about internet connectivity, Comcast apparently has opened up all of their Wi-Fi hotspots for free. So you don't have to have a Comcast account to use them. And you can go to, if you just Google Comcast COVID, you'll get to their COVID page where they sort of announce this policy that they're making it that indefinitely anyone can use their hotspots anywhere in the city. And then there's a link to a map. There are a lot of them in St. Louis Park, like a lot of them. They're all over the place. So I don't know the exact distance they cover, but there are a lot of dots all over the city. So I would encourage folks, if they do not have internet at home, that is an option for them. Of course, that changes if we end up issuing a sort of shelter-in-place order, and they're not able, if they're not covered by that, I don't know. We're a long ways from that. I'm not suggesting that that's where we're at, but I just wanted to make sure for anybody who might be listening that they knew that if you go to Comcast's COVID page, there's a link to their map, and you'll be able to find a hotspot hopefully near you that is easy to use. Yes, Chief.
Mr. Mayor, I'd just like, it would be important to add that we have a number of private schools in the city, and our SROs have been in contact with them. So they're following the guidelines also the governor set forth, and closing at various times, either today, tomorrow, or Wednesday at the latest. Those include Benilde, Groves Academy, Torah Academy. We have 2 yeshivas in town, a boys and a girls yeshivas, and the JCC has a elementary school. The only one that is not closing is the boys' yeshiva, and they're required to be there. So we're going to, Steve and I had a conversation yesterday, and we're going to be talking with them about some mitigation strategies with them.
Okay. Ann?
I have a separate question, so if others have school-related issues.
Anything else? Yeah, Larry?
Yeah, on the school-related, the other, we don't deal with it here, but the number of kids that get meals at school, and just understanding how that's being taken care of as well.
I would, what I might recommend, because I know that we will all have those questions, and there may be answers coming out of their board meeting tonight, which they're meeting right now. So maybe what I would suggest is that, along with other questions that we may have that don't get addressed tonight, can be funneled to Tom, and we can ask him to follow up with Aston and others. Other big items, and you said you wanted to...
Well, that actually is exactly what I was going to ask about, because I think from the number of issues that Margaret had asked about forbearance on utilities and different kinds of things, I think we have buckets of questions already. I would like to add to that as well. As we are, I am decidedly not looking at my own retirement savings in the stock market. I've got enough stresses in my life right now, and I'm assuming that the city's reserves are more conservatively out there than...
What are you investing in?
Mine are. It was a great idea for a while. But my question would be, as we report back about the city's navigation through this situation, that we can get a handle on reserves, knowing that we will have greater demands on our financial resources to support our community members, our businesses, even city staff and functions for all kinds of additional costs, and to better understand what that horizon looks like when it becomes more serious, and how we need to moderate some of the financial decisions we're making now in order to plan for that later.
Did you have a question, Mark? Yep.
You said that so much better than I would have, but I had the same question. Very well said. Just one brief comment, which is, can we ask, I'm sorry, but I just have to put this out there. Is it appropriate to ask community members to report to the city if they have been tested positive? I know I've seen on Facebook people saying, I think I have it, various comments to that nature, and it just feels like perhaps if we could directly ask the question, if you are tested positive, it would be helpful to the community for you to share this with city staff. Is that a message we as council members could be putting out there?
I think I'm not sure what we would do with the information, and in a protected way. We wouldn't have to be able to put that into an electronic health record that would be protected or not somehow used against that. I think what we need to do, I think the most important thing is they got to a healthcare organization and got confirmed, and hopefully they're sheltering in place. Whether we know about them before this other problem is worked out, most importantly, we want them to stay home, shelter in place, and make sure if they've exposed their family, everybody in that house, everybody in that household is sheltering for 14 days. That's the guidance, and as opposed to having them tell us that, because it would be hard for us to manage that information in a way that I could guarantee that would be confidential.
Got it. Thank you. That makes sense.
I'm going to just, I think, bring us home if folks are comfortable with that. Again, if you've got specific questions or observations and suggestions, let's get those over to Tom. I do have one last question, which is sort of for my colleagues. So, Tom, as a matter of practice, you send us an end-of-the-week email. I know that at my day job, we are doing a morning call and an afternoon call, and I'm not suggesting that you want to do anything like that. However, I am wondering if, I know I would appreciate perhaps an end-of-day email from you that sort of says, here are the things that happened today, here's kind of what we're teeing up for tomorrow. And I'm not thinking indefinite, but perhaps for the balance of this week and maybe going into next week, we can reassess. But I think for us as council members, especially focusing, and Jackie, this is kind of where you come in, and Clint, focusing on what we should be telling the public and can be sharing with the public. We want to be helpful. I think everybody, many of us anyhow here, have neighborhood newsletters that they put out and email lists that they've got that they can blast to, and social media accounts. This would be a great time for us to make use of those. But I know for myself, I'd love to get an update at the end of each day, maybe sent to the council would be helpful. So with that, I want to bring this to a close. I do want to just say that some of this has been said already, but I want to sort of bring it forward, which is this is a very dynamic, how's that, Chief? I didn't use fluid, I didn't use changing, this is a very dynamic situation. I would just suggest to the public, be careful about what you share on social media around this. There is a lot of misinformation out there, a lot of salacious headlines getting people's attention. And I would just caution people to make sure that you're being thoughtful and deliberate and measured in your response. We are being thoughtful and deliberate and measured in our response here at the city and trying to respond to this. We're not reacting wildly to things, and I would ask our residents to do the same. The other thing that I would just say is that, and it was alluded to or mentioned, I think so by some of my colleagues, this is a time for more patience than less. It is a time for more tolerance than less. It is a time for more kindness than less. This is a super stressful time for every single person in our community. And now, more than ever, I think, as I said in my Facebook post, just shooting, even just shoot someone a smile. But folks need it right now because everybody feels under a tremendous amount of strain. And I will also just ask, if anybody has any toilet paper, would you let us know? We're down to like 2 rolls, people, and I kind of thought this would be fine and we'd be okay, and this is no big deal. We've been to about 15 places looking for toilet paper, and I don't understand why we're buying up all toilet. But
All I'm saying is, I lived in Russia for 4 years, and newspapers work
No.
just fine.
no,
Right
no,
on.
no.
Napkins, you name it.
That is time. That is the sign. All right. Thanks, everybody. We appreciate it. Chief, everyone's, our department directors, thank you so much for all of your work on this and work that will come. I did not hear objections to me signing off on this, so I just want to make sure I'm sort of doing one last check here.
I think it would be, I think it would be appropriate for us to do a motion of support for this. And
Okay.
I would so move, oh, no?
Yeah, so one, there's 2 documents.
Thank goodness there's a parliamentarian in the room.
So once we get to the council meeting, there's 2 documents. One is the proclamation that you'll notice that the mayor read. And just to be clear on that, the reason it's written that way with the language about the mayor declaring is that's exactly what the statute says. So it wasn't meant to exclude the council. The statute contemplates that the mayor can declare an emergency for 3 days. Briefly, the reason 3 days is the legislation was largely written for events like tornadoes and other things like that. The resolution is actually there as the emergency's been declared, but we as a council want to extend it beyond the 3 days, and we tie it to state and federal declarations of an emergency. So
It'll run along with those
Yes.
dates. So
Correct.
then does it
So
end, I'm sorry.
Well, so my motion would be resolution number 20068.
Yeah, or 6, I think.
Didn't have my glasses on. Okay.
So, and in terms of how we do it, once we get to the council meeting, the council rules of procedure in terms of adding items to an agenda, we've talked about this in the past, does allow when there's an emergency type nature or something of an emergency nature can be added to the agenda by a vote of the council. It does need to take 5 votes to put it on, but it seems that if you're contemplating a declaration of an emergency, that in fact constitutes an emergency, so.
So when we get to that point on the agenda, I'll just ask if there are any additions, changes. I think, Margaret, you had something you wanted pulled off consent.
And I'll
then
add that
you
on.
can just make a motion to put resolution 20-066 on the agenda for tonight, and that'll become 8C when we get to it. Does that sound right?
That's good by me.
Okay. Yeah.
I'd like to take a 5-minute break and then come back at 7:05 for EDA.
She's running the EDA meeting, so, yeah.
So, Tom, is there anything else that you need from us? And we have I heard that the next time we can make decisions is 3 weeks. Is that sufficient right now?
Right now, there is nothing that I need from the council officially regarding this particular item that would necessitate us meeting before April 6th. If something comes up, then I will definitely be asking you to do that. One of the things that I'll be doing in the intervening period of time is talking with Derek about the needs of STEP and in the event there is something that would require us to meet, then I would schedule something. But right now, no, I don't have anything.
All right.
What is always helpful is if, you're the eyes and ears out there, if you, if you hear things, it's always good to know. If you wouldn't mind sharing that with me. Maybe we can do something about it, maybe we can't, but it's just good to know what you're hearing out in the community.
All right, so let's go ahead and actually come back. I just asked Rachel at maybe 10 minutes after, so everybody gets a chance to use the restroom, what have you. Get a glass of water.
Thank you.
All right, thanks, everybody.